Good afternoon. I'm back. Back from my week off, feeling rested, which is good because we have a lot of challenges ahead of us. So welcome to our weekly update around COVID with the Department of Behavioral Health. I want to start off by acknowledging that we had sent out a contest to recognize individuals who exemplify our guiding principles for care delivery. And we had over 50 nominated individuals. So those certificates will be getting sent out in the next few weeks. And then in one of my upcoming weekly updates, we'll be doing some drawings for winners of prizes. So this is the first time we've done something like this, and we're really excited that we had such a great response. And so you should look forward in the next few weeks to some further announcements regarding that. Okay. So COVID has kept up while I was gone in 2 weeks, and we now have over 10.5 million cases of COVID across the world, and we've now exceeded over 500,000 deaths from COVID. In the United States, we have over 2.6 million individuals who've tested positive for COVID, and over 127,000 deaths from COVID. In California, you can see that we have continued to increase. We have almost 223,000 cases of COVID through 2 days ago. Remember, the state's numbers are always behind. And 5,980 deaths from COVID. On the right-hand side of the screen, you can just see some reference that we've had an increase of almost 66,000 cases in the last 2 weeks since I reported previously, and over 772 deaths. I did want to mention that as of today, over 4.25 million tests have been reported across California. And if you look at all of California and all of the testing that's been done, we've had about almost a 5.5% positive rate. So at any given time with testing, about 5.5% is positive. This next number I wanted to share with you, this is Fresno's numbers, and I'm specific to Fresno because we're going to talk in a little bit about some new actions that the governor has taken in response to some counties like ours having an increased experience of COVID. So this slide shows you for Fresno County, we have right now about 171 individuals hospitalized with known or suspected COVID, and that is today. And about 37 of those individuals are in the ICU. 33 have known COVID, 4 have suspected COVID, so they've been tested and we haven't gotten the results back. We have about 164 licensed ICU beds in Fresno County, and our current capacity, which was on the last screen as well, is 74. That means 90 of our beds right now are taken up, and as I mentioned, 37 of those by COVID. That sounds like a lot of capacity. Almost half of our beds are still available. But a problem we have in Fresno County is that we have about 300 hospital staff out or more across the county because of quarantine. So they've either been exposed to, tested positive for COVID, et cetera. And so it's really creating what we'll call a staff shortage, and so staffed bed capacity has reached a critical situation in Fresno. And so this is a really big concern of ours. And I'll talk about that a little bit more in a minute. The next slide will show you some information about deaths. I know I've been asked at different times about comorbidities as well as age ranges. And so across California, you can see that certainly the largest number of deaths by volume is in individuals over the age of 50, but 35 to 49 has or under 50, we still have seen about 350 deaths. So by far, 80 plus is the biggest. We've mentioned previously that in nursing homes, and I'll have a slide on that in a second, we've definitely seen a large number of deaths there. The slide or the table on the right shows some death information in Fresno County. So the left-hand slide is California and the right-hand side is Fresno. You'll see here 67 deaths. We actually have more than 67 deaths, but this information, as I've mentioned previously, often is in arrears, so it takes a while to catch up. And here, about 10 of our 67 deaths have no known or unknown comorbidities. And that includes an individual who was in the age range of 45 to 64. And we've also had a couple of deaths under the age of 45. So something that we're watching closely. This next slide shows you specific to skilled nursing facilities across the state. You can actually go on the state's website and drill down into individual facilities in our county. But in terms of a roll-up, you can see here that there has been a higher percentage of positives in residents of long-term care facilities, so 6.4% as opposed to 5.4% across the state. And then related deaths, 2,480, so a little less than half. I think it's now around 44% of the deaths we've experienced in California have been residents of long-term care facilities. But I really want you to look at the information below. Over the time of COVID, 8,739 workers within skilled nursing facilities have tested positive and 92 have died. So 92 workers in skilled nursing facilities in California have died of COVID. All right, so in Fresno County, we've seen our number of cases go up significantly. You might have seen in the newspaper that we do have a large number of individuals who've tested positive for COVID in our jail. I think we're up to almost 560 inmates in the jail have tested positive, as well as somewhere between 20 and 30 of the jail correctional staff have tested positive. We have had 73 deaths in Fresno County. That's an increase of about 12 deaths since I last reported a couple of weeks ago. We do, typically you'll see the number of positive cases go up quicker than the number of deaths go up. And I think I've mentioned previously that oftentimes when people die from COVID, it is some time past their positive test result. So the recent increases we've seen in positive cases in Fresno County is really concerning, because what typically happens when you start to see that bubble go through is then you'll see people hospitalized, which is what we're seeing right now, significant increase in hospitalizations, and then later deaths will follow. The state has developed what's called a watch list, and this is based on a number of things. It can be positive test rates, greater than 8%, local outbreaks, lack of testing or contact tracing capacity, hospital impacts, such as what I mentioned earlier. There are now 19 counties on the watch list, and if you're on the watch list and you're in that kind of realm, and this includes Fresno County, if you've been on the watch list for more than 3 consecutive days, some new measures, one of which was announced over the weekend, that bars would reclose, and now today a number of other new measures for the 19 counties that have been on the watch list for more than 3 days. And that is all indoor activities associated with dine-in restaurants, movie theaters, family entertainment centers, zoos, museums, and card rooms. So in looking at that list, you can see that some of them are going to be more challenged than others. If a restaurant has a patio, they can continue those services. They certainly can continue takeout and curbside delivery of meals and such. I know some movie theaters have done drive-in movies and things, but these are going to be in place for at least 3 weeks while we see if we can get a handle on this surge in cases and, more importantly, the surge in hospitalizations. So this slide will show you the watch list, and it shows you a picture of this state. The counties in orange are counties that have been on the monitoring list for 3+ days, and so that's where the new restrictions will go in place. And this shows you that for hospitals across the state, there's been a 46.2% increase over the last 2 weeks in hospitalizations and a 41% increase in individuals who've been hospitalized in the ICU. That leaves about 33% of ICU beds available. We do have plenty of ventilators, it seems. We have 73% of the ventilators available, but that 46.2% increase and 41% increase are what is the great concern. The next slide will show you Fresno's information for the same. We've seen a 66% increase in hospitalizations and a 54% increase in individuals in the ICU. And this shows that across the county, we only have 28% of our beds available. And so this also, even though we have 164 ICU beds, remember that even though that prior screen showed 74 beds, if they're not staffed appropriately, they're not considered available. All right. Some other actions that are being taken for this 4th of July weekend. We have some 4th of July weekend restrictions. The state beach parking lots will be closed. At this point, the governor isn't closing the beaches themselves, but the parking lots will be closed. If a county, and there's a couple of counties, I think maybe Orange and Los Angeles, are closing their local beaches to anyone to be on the beach, not just the parking lots, then the state will close any state beach in that county to support those county efforts. So if you had plans for the 4th of July weekend and planning to go to the beach, you might want to check the county you're planning to go to and see if the beach will be open or not. Other state parks are remaining open with some reduced visitation and limits on overcrowding. And then all of us as residents of California are being strongly encouraged to not gather with people who do not live with you, so including other family members. So those of you, and all of us I've had an experience where I've gotten together with family members. We're really being strongly encouraged not to get together certainly to avoid crowds, but really not to get close with people that you don't live with, unless you're doing that masking, the distancing, washing hands frequently. Preferably, if you're going to interact with people, you're doing it in an outdoor, well-ventilated setting. This is the way we're going to get control of it. I'm a little frustrated. I'm going to be frank with you. I see lots of comments on social media. My frustration isn't with you. I see lots of comments on social media. People are really angry and mad at these restrictions and questioning the validity of them. And I really have to tell you that we have to learn to live with COVID. We have to figure out a way to follow the precautions and keep it from overwhelming us. This is a definite sign right now that we haven't done a good enough job. We haven't figured it out yet. This is new for everyone, and we're tussling with that conflict and tension around what rights are and the accuracy of information and all kinds of things. But in the meantime, COVID's just marching along. It's just marching along, making people sick, getting people hospitalized, and killing people. And so we've got to figure this out. And we know that if we mask and if we stay 6 feet apart and don't get in close, crowded areas, that we'll do a better job figuring out how to live with COVID. So Again, we really have to do our very best to follow those precautions. The governor did announce today that they're putting together an enforcement team. A lot of counties, including ours, have had law enforcement say they simply don't have the resources to enforce this. And so the governor has recognized that and is putting together multi-agency teams to partner with local departments of public health and businesses to protect workers and the public. We've all, one of the areas we've seen positive rates is people who are on the front lines, not necessarily in healthcare, but in grocery stores and places like that. So we really need to protect people who are working for us. And so they're partnering with Alcohol and Beverage Control, often referred to as ABC, Cal OSHA, which monitors work sites, the Department of Business Oversight, the Department of Consumer Affairs, and the California Highway Patrol. And so there will be enforcement activities going on. And this is not to take away your rights, but to protect us, to really try and ensure that we can learn to live with COVID. All right, so what are we doing? We're going to have decisions related to return to work will carefully continue. You should expect that based on business need, we will bring some staff back, but we're doing our very best to ensure staff safety when we do that, and working with both human resources as well as Maine County to ensure that the decisions we're making and with public health and our public health officer to really check all the boxes. I mentioned last time, and we're continuing to look at telework and telehealth services continuing in some capacity through the end of what's currently our ability to do so through September 30th. We will be developing written guidelines for telework, and those are things that typically we have to work with our labor partners on, so we'll be doing that work, anticipating that eventually this will become a long-term way for parts of our department to do their work. We're going to continue our daily remote health screening to keep all of you safe, and then we're working really hard to ensure that at all times we have an adequate supply of personal protective equipment. So still a lot of activities going on. We're also, really looking to do some careful review of the telehealth services we're providing. We've gotten feedback from some of you that while it's generally went well, you have some individuals that you're serving that you worry about their ability to maintain their stability without having some in-person services. So on the clinical side, we'll be carefully looking at how can we do things differently? How can we ensure that we're keeping people safe, but maybe it's not going to be a clinical service delivered in that typical small office with one staff member and a client where you really couldn't maintain that physical distancing. So we'll be looking at conference rooms, and we'll be looking at some other strategies that would enable us to see people in person when that's needed beyond urgent and emergent needs. Maybe have a rotating schedule that goes through. But that's a careful process. It's not happening next week, so don't panic. But just know that we are aware that we need to come up with some strategies. I think if you didn't recognize it or acknowledge it before, this is going to be a long-term endeavor dealing with COVID. And so we've got to figure out how to make it work, not just over the next few weeks, but for the next several months. At a minimum. And so as we go through that process and carefully consider what we need to do, just keep your ear to the ground, and we would like your input. I know some people reached out to me over the last week expressing some concerns, and we appreciate that. Please let us know if you have ideas or thoughts or concerns, if you're beginning to sense in the people you're serving some frustration or need for us to do things differently. That is feedback that you should be providing to your supervisors as we carefully craft a way forward. Okay, time for question and answer. Do I have any ideas of how working at the office will look like for clinicians and case managers when providing treatment? Well, this is one of those things that kind of goes along with what I was just mentioning. I think it's going to look different. I don't know exactly what that's going to look like, whether we'll repurpose conference rooms or come up with different buildings or offices that we're going to repurpose to clinical care because we can set up a safer environment, or whether we'll have shorter visits more frequently or things like that. Those are the types of things that we'll be looking at. And so you should just, again, if you have ideas, let us know. One of you asked, my clients who are children are asking when we will see clients again. This is, again, we don't have a time frame, but we are interested in your input. It's something we could implement sooner if we can strategize and work through any of the barriers. So again, we're trying to create a safe environment. So here's the kinds of things we would look at. Do we have a space where we could keep people at least 6 feet apart? What is the likelihood that everybody involved, including the children, would or could wear a mask? And it's not saying they would have to, but we would take that into consideration. Maybe if they couldn't wear a mask, we'd put some additional measures in place. And then what's the amount of time you would be together? And so those, and what's the interaction? Can we, if there's some sort of play therapy going on with the children and there's toys or different things involved, we just want to make sure we had an infection control process in place. So those are all the things we would look at. We'd look at ventilation of the room. Could we set up any sort of outdoor environments? It's going to get hotter, that could be more difficult, but those are the types of things that we would look at. And we're really interested in your input as to what should our sense of urgency be to implement that. If you're beginning to sense frustration or the need from a clinical perspective to see people in person, then we need to be working on that and we need to develop those strategies. What is the county's plan for when our hospitals no longer have any more ICU beds? So I'm on calls all the time where we're talking to hospitals. Here's the types of surge capacity strategies. I think I mentioned this previously, but most hospitals have areas of the hospital where they provide ICU-like care on a temporary basis. So individuals coming out of anesthesia, even for same-day surgery, it's called a post-anesthesia care unit, a PACU. Those are set up and could be repurposed to be ICU beds. And hospitals have already, as part of their surge capacity planning, most hospitals in Fresno County have identified space within their hospital that they could increase the number of ICU beds. Probably the bigger concern right now is the ability to staff those beds. The more staff that have been exposed to COVID where they weren't wearing a mask, and sometimes that's happening because they have a loved one at home who has COVID, and it's not necessarily a work exposure, then they will address, they won't be available to staff that bed. I will tell you that the CDC has advised when you get into that situation where you're running out of staff and you need staff, that you can bring back staff who are positive for COVID if they're asymptomatic and wearing a mask. So those are the types of strategies that hospitals have to consider when we get into this very dangerous zone here. And that is even asking people who are COVID positive, asymptomatic, to come back and work with a COVID positive patient while they're positive. There's also some talk about a couple of facilities within Central California being repurposed to be we'll call alternative care sites or surge capacity facilities, and there's work being done right now today on one of those facilities that would be available then to send people to. I will say there's parts of the state that are in even worse shape than us. Imperial County has been sending patients out of their county for the last few weeks. All up and down the state. They've run out of ICU beds. They've run out of hospital beds in Imperial County probably 2 weeks ago. And so we don't want to get to that point. And so those are the types of things that we'll be looking at. Telework was extended through September, but I was told it was now mandatory to report to the office. Is that accurate? I need you all to understand that based on work need, you will either work at the office or you will work at home. Telework getting extended has nothing to do with our ability to bring you back if we need to. Of course, we're going to do that safely, and one of the things we're doing, one of the reasons you might be asked to come back 2 days a week is we're trying to be as equitable as we can as well, although it won't always feel equitable, so please be aware of that. I need your patience and tolerance. We are trying our very, very best here to keep people doing their job, to keep the work getting done, to keep people employed. And that's going to require flexibility from all of you. But we have work that needs to get done. So some of you are going to be asked to come back. Some of you will be asked to come back every day of the week. Some of you will be asked to come back just a few days a week. And we'll rotate people through so that we don't have too many people in buildings at the same time. But I need your support and I need your patience. We're trying our very, very best to ensure that the work that we need to do to support the people we serve gets done. And that's going to require some of you to come back to the office to get that work done. Again, we're wearing masks in the office now. We have lots and lots of measures to keep you safe, and we'll do it safely. Okay. Are there updates regarding hiring more clinicians and clinical reassignments? I get this question every week. Working diligently on that, hope to have some progress soon. And then any update on laptops? Yes, we are getting more and more laptops in, and as needed, we are deploying those out. It is a process. There's setups that have to happen, and it takes a little bit of time with each individual. So just over the next few weeks, you should expect, if you are set to get a laptop, then you should expect to get an appointment to get that laptop. If you're not sure if you're getting a laptop, you need to talk to your supervisor who's working diligently to determine who needs a laptop and how that will fit given the number of laptops we have. All right, I don't see any other questions. Again, I really, really thank all of you. I know that this is a very trying time. I'm sure, like many people in our community, in the world, in the United States, there was a little bit of a sense a few weeks ago that maybe there was light at the end of the tunnel. And that light is still there, but that light relies on all of us doing our part and sharing with the people we know the importance of doing our part. It's kind of like wearing your seatbelt, following the speed limit signs. We just have to do the things that are going to keep all of us safe. And so I really appreciate the work that all of you have been doing. There's a number of us that have been coming to work in the office every day, and many of you working from home every day, and that effort is really paying off for us in terms of meeting the needs of the people we serve. We do recognize, as I said previously, that we'll probably have to do some tweaking and adjusting to be able to accommodate more in-person treatment as needed. And then to meet the business demands, we're going to need flexibility in terms of people coming into work when needed. I can tell you again that we're doing everything we can to make that interaction safe. Again, many of us have been coming to work throughout this whole process, and we can attest to the measures that have been taken. But that's how we're going to get through this. That's how we're going to learn to live with COVID while we do our jobs meeting the needs of the people we serve. So I really appreciate that. Okay, one more thing. From a quantitative perspective, what are our attrition rates? Lower organizational productivity or about the same? Okay, I'm gonna kind of guess on attrition rates if you're talking about the people we served. What it's looking like is we're providing services to more people post-COVID than pre-COVID, and more units of service are being provided post-COVID than pre-COVID. Very tentatively, and we're doing some research on this, it looks like fewer hours of service are being provided. And we're looking into that to see if that's the case. It may be that the service is being provided. Some of them may not have a time associated with them. It may be a function of how we record telehealth or telework in a billing code, not really sure. It may be that we're interacting with people more frequently or more people, but just for a shorter period of time each time we interact with them. The good news is it looks like generally, particularly for mental health services, we're doing more. Now, substance use disorder services, we're really in arrears or behind on getting those charges into our system. They come in a little differently through Avatar than the mental health does. So it's a several week delay. And so right now it's hard where we're at in terms of our time to get the billing, and it's hard to tell what the impact is. What we suspect is that there's been a bigger hit, if you will, on SUD services than mental health. And the reason for that is that some of the SUD services didn't have the same waivers afforded to us as quickly as mental health services by the state and the feds. And so it made some of the services more difficult to provide. And then some of the services, like group therapy and such, which is kind of a hallmark of SUD services, were a little harder to provide in a virtual setting. I think many of those barriers have been addressed as we've moved forward, but I think we will find, at least in the beginning of COVID, that we'll see a dip. What that dip will be, we're watching very, very closely. We get a weekly report and we're watching it as the billing comes in. You can see the numbers go up early in the fiscal year or early in the calendar year, but we haven't quite gotten to the point yet where we can see the impact of that. All right. And with that, I think that will conclude today's presentation, and I'll be back next week. We'll see you then.